Good afternoon and welcome. This podcast is part of the work of the Victorian Bicultural Workers Network, facilitated by CoHealth's Bicultural program. Through these conversations, bicultural workers share their community's experiences of mental health, well-being, and accessing supports. These stories are shared to help mainstream services better understand the needs, strengths, and perspectives of refugee and migrant communities, and to reflect on how they can work more effectively and safely alongside them. Before we begin, we acknowledge the traditional custodians of the land on which this podcast is recorded, the lands of the Wurundjeri and Bunurong peoples of the Kulin Nation. We pay our respects to elders past and present, and we acknowledge that this work takes place on stolen, unceded land. We recognise the enduring leadership, strength, and wisdom of First Nations people in navigating, surviving, and challenging colonial systems, and in bridging divides to support the well-being of their communities. My name is Jasmine Phillips, and I'm the Bicultural Program Lead at CoHealth. And joining me on the podcast today is Mona Adnani-Salehi, a bicultural worker at CoHealth. And I would like to invite you, Mona, to introduce yourself and tell us a little bit about your cultural background.
Thank you, Jasmine. I was born in Iran. I am Muslim and come from an Arabic culture background. I speak Persian and Arabic. My culture values family, respect, hospitality, faith, and resilience in the face of hardship. Like many in our community, experiences of migration and displacement and living between cultures have shaped my personality and who I am, and little bit complex in our life and accepting new culture in new community.
Beautiful, thank you. What do you think are some of the greatest strengths of your community?
Greatest strength of our community is our strong sense of family and social networks.
Mm.
During difficult time, people are rarely left alone and often receive emotional and practical support from family members and social networks. Resilience and the ability to help each other and support each other as much as they can.
Mona, how do people talk about mental health in your community? What kind of language do they use, or how is it described?
In our community, mental health is not discussed openly and directly. People are more likely to use like a different expression such as I'm tired, I'm exhausted, I feel lonely, I
Right.
am emotionally exhausted, or I can't do it. But we try to just help each other, support each other, and not asking too much because we know mental health issue is not discussed openly in our community.
Do you think that there is stigma attached to the word mental health?
Yes, usually people, rather than seeking support for depression and anxiety, they are seeking for making their faith stronger than they have. And also, sometimes is taken as a personal weakness or lack of the faith rather than medical condition.
So you've started to answer my next question, which is about how communities usually seek help or support when they're
Yes.
struggling with their mental health and who they speak to first. So you're saying they go to their faith leaders and they seek support there and their community leaders?
Yes, usually it's happen. Yes, it's happen. They pray. They just try to just rebuild their faith, and they not seeking medical help they are seeking individual or support from the community, family members, or sometimes the like a religious leader. But in our community, mental health usually considered as a weakness or lack of faith. So this is sometimes make mental issue is difficult to understanding. Migration is often make a big trauma. Losing of support networks, financial pressure, discrimination, and the identity struggles, experience of war, a forced to displacement, or visa insecurity can make a big role to develop anxiety and depression, particularly among first generation. And it is really stressful to cope with everything plus mental issue, to not disclose with the community, with the services around us. When you are just changing place to place in the same country, in the same city, it would be stressful for you or for me. But just imagine when we are just changing country and leaving everything behind, leaving families, leaving all of the things that you build it, but you coming in a new community and you need to cope with many different struggling to find a right place, find right community, connect with new community. All of this is stressful for the new people, n- new arrived people in this country. It is big challenge. It was for me. It is big challenge, especially when you have young children with you and this different culture and different community and different belief.
Thanks for sharing that. And what do you think are some of the challenges that people from your community face when they do engage with mainstream mental health or other health services?
Language barriers and the lack of the culture appropriate interpreter. Sometimes interpreter is even not helping us, especially in mental when it comes to mental issue, and you need to talk from your heart with your specialist, with your counselor, with your psychologist. But when the third party is there, it's really difficult. Sometimes services listen to us and they said, okay, why you are continuing with this life? But they don't know anything about our culture. They don't know anything about our background, about our beliefs. They just asking why you are continuing this life, but they don't know anything what is behind that. Distrust of the system. It is very important. It is a lot of misunderstanding around us because sometimes we have fear to disclose our mental issue or many issue that we are facing it because we are thinking we going to cause more problem for our family, and we getting into difficult things with the system and government.
Can you elaborate on that, Mona, and tell me what you mean?
Yes, I can give you an example. Recently, I had a difficult situation. One of my friend in my community.
Right.
So he faced a lot of problem in the past, but still this problem continuing with her. She's 75 years old. She is scared to talk about her fear, about the discrimination that's happening inside her family, not outside that, because she doesn't want to cause more problem, and she might not get her visa in the future because she's telling about her problem, her mental issue, and violence that she's facing in her life. So she stopped to talking about that because she didn't have good understanding of system
Mhm.
because of lack of information or distrusting the services. They are not talking. If something happened to them, if
Mhm.
something, it is scary. It is scary, and they have fear of the future. What's happening? What the next step? And if I'm talking about my situation here, what gonna happen? What gonna happen to me?
Mhm.
If they send me back to my country, if they are not approving my visa. So this is scary. Yeah. This has happened a lot around me.
What's something that you wish mainstream organizations understood about your community, for example, about their culture or their way of knowing?
Family,
Yeah.
honor, respect, and cultural context. They are playing big role to making a decision, especially about mental health and well-being. They need to know about the system, understood within the individual culture and religions and social framework, rather than treat them as like a clinical issue. So
Mm.
clinical issue, yes, this is very important. But I think for the people from different background, we need to have a good understanding of their culture, of their background, what's happening in their path. And when we are coming in new community, what is cause mental issue, financial issue, education, and teaching them about the services and community and make trust between their culture and new culture,
Mhm.
which they are new and coming here, and new culture, new environment, all of them causing a mental issue.
Mm.
Yes, this is very important because they don't know what's happening in the future and they need proper information and advice.
I think you've already started to answer this last question that I have for you, but I'd love to hear your perspectives as a bicultural worker. What do you think the role of a bicultural worker can be in supporting communities' mental health and access to support services?
Yes. Many people, they don't know what the importance of the bioculture. Many people, they attending our session and they finding our session is just fun and spending their time. But when they continue with us and stay with us, they learning a lot of things. And even we try our best, we try our best to connect them with right services and looking after their needs. Bioculture, by building trust between community and services.
Mm.
Because when they are newly arrival, they are not trusting system immediately. They need a third party between them. Some trusted for themselves in their culture and new culture. Provide culture interpreter, like an interpreter, and raising awareness about mental health and supporting individuals to navigate and access services, reducing stress,
Mm.
learning about you, and learning you are from community and working for community. And one day they can also make it and reach or access the services and improve their mental issue, improve their level of living, improve their education, improve all of that factors they scared of. And they think at the first stage, you are like them. You are not someone from a system, coming from system, from the organization. When they build trust, they just understand that they are you are supporting them and they are safe with you
Mm,
before they are getting into next step. Because I came from their culture.
mm,
If I could make it, also they are have a strong belief they can make it. And little bit they started to trust you, trust the system, trust the government, trust everything, trust the rules. Because I'm one of them, and absolutely I faced all of the problems, all of the difficulties that currently that they are facing it
mm.
in their lives.
Is there anything else you want to share before we wrap up the interview today? You've shared so much already and so many great insights. Is there anything else you want us to share on the podcast today?
Not really, but in addresses the root cause of the silence around the mental issue, it is lack of understanding and
Mm,
judgment and trust. We need to build all of this and think about all of these factors and study and step by step and help them to trust the system. And I will talk about myself. At the beginning, I had a lot of fear. I couldn't trust system. I couldn't trust even social workers when just had my issue and I had to talk with the social worker. And still, when it's coming to system, still I just step back. I said, I'm not sure if I have to discuss my problem or not. If there is any more issue coming in my life, or I just taking away some issue because I'm not sure. Now I have a better understanding of the system, and we need to just build that for community and for people who are coming as a, like a, and leaving everything behind and coming to build a new life and better life and new community in new environments.
yeah, building their understanding of the system and their understanding of their rights within the system as
Exactly.
well. Oh, thank you so much, Mona. It's been
You're
such a
welcome.
privilege to speak with you today, and I'm in awe of all the amazing work that you do with your community. So thank you for your time and your sharing and all the work that you do.
Thank you so much for you and all of your time. I appreciate your effort and time for, and what you are doing for community. Thank you so much, behalf of my community also.